I'm introducing ourselves now as the next speaker. It'll be myself and Kassie Hurt. She's an LPN in our clinic and works with Dr. Shaw and Dr. Malik with our Parkinson's patients. And she's going to start off our project here.
Well, good morning and welcome. It's great to be back and see all your smiling faces at our annual Parkinson's Patient and Caregiver Conference. It's been a while since we've been able to do this, so I'm glad that we are all able to get together now. Like Natasha said, my name is Kassie Hurt. I'm an LPN at the MU Neurology and Sleep Disorder Clinic. Some of you have probably seen me when you come in for your appointment. And I've been blessed to be a part of the neurology family for about 5.5 years now. And it's just been a huge education for myself, as well as being able to support you all. Natasha and I, we've been invited to share with you the nursing side of the care and treatment of our Parkinson's population. There are many components that we can use to contribute to your care and your higher quality of life, so to speak. We are able to order physical therapy for you in support of the doctor's order, and with that, physical therapy can enhance your life in many ways. It helps with mobility, flexibility, stretching, with gait, strength training, balance, which is super important. And we also have a new component that has come into the mix. I've learned that it was developed in 2006 by a prosecutor in Indiana, and it's called Rocksteady Boxing. And the more I'm in neurology, the more I'm familiar with that. And I think it's a great feature for physical therapy and a way for people who their joints get stiff, or you get a little weak or tired or what have you. That just helps with the strengthening. And we also at the neurology clinic, we order some of this as a mode of transportation, so to speak, to help you, to assist you, to help you stay independent for as long as you can. There's the quad cane, of course, and then there's also a laser cane. And this is one of our favorites at neurology, the U-Step Walker. It has a lot of bells and whistles to help people afflicted with Parkinson's to be able to man their gait and to be able to keep it straight and more independent. And then, of course, we have the wheelchair, which is, I like to say it's for distance mode, where if you're going to be traveling somewhere or like come into the neurology clinic and having to come from the parking structure, this is probably going to be one thing. This is probably going to be one thing that you're going to want to have, because it's hard enough for us as humans to walk that great distance, but when you have issues with your gait and balance and what have you, it doesn't take long for you to get tired. And another component, next slide please. Another component of that we like to be able to teach and be a part of is speech therapy. And sometimes you have questions about, how can speech therapy improve my life? Of course, it's going to improve your speech and your communication. There's also a new type of speech therapy that I've recently learned about. It may not be super new, but I've recently learned about it, and it's called LSVT, big therapy. And what happens there is they teach you to talk to stronger, not yelling, but to talk stronger, because as we all know, that folks with Parkinson's start to soften their speech and or talk in a raspy tone. This is a way to help keep your vocal cords stronger. They also have big therapy for physical therapy, where they use bigger motions to kind of help keep the brain triggered to be able to walk a little more sturdy, or walk, or have a better flow when you walk. So in just recapping speech therapy, speech therapy is also very, very good for strengthening the vocal cords, and they do a lot of work with swallowing. And on that, I'm going to turn it over to Natasha, who's going to talk about nutrition and hydration.
Thank you for that. Yes, the speech therapy is important with swallowing because, as we know, patients with Parkinson's also have an increased risk, and many of them do have issues with constipation. So nutrition and hydration are essential for kind of trying to combat that, and swallowing comes along with that. Also with Parkinson's, Parkinson's patients have a harder time sometimes getting all their calorie intake, and also the amount of water intake that they need, sometimes due to tremor, sometimes due to decreased appetite, or some side effects of some of the medication that you take, like nausea. Those type of things all impact that. And we do know that with constipation, adequate water intake along with a high fiber diet is also essential, but those two things sometimes are a little bit more complicated to do with Parkinson's. So some using smaller, more frequent meals, trying to use a straw to get your water intake, those types of things, trying to stay hydrated, and lots of fresh fruits and vegetables with that also help with that.
So the next thing that we like to talk about at the clinic is home safety. There are some changes that unfortunately need to be made in the home as you progress. For one thing, you need to get stuff out of your way, because if you're walking and you happen to sidestep or lose your balance or get dizzy, you want to be able to have a clear path to wherever you're going to, and not trip over anything. And also, like rugs. The rugs are a huge tripping hazard. So if you can either get rid of the rug or put that double-sided tape on that, and that will help with that too. And you, of course, use assistive equipment in the bathroom, and secure your furniture, because part of that, like some of our providers have talked about, when you stand up, and you really need to take your time. Give your body a chance to recoup before you start moving. But, sometimes when you get up, you stumble backwards or sideways or whatever, and if your furniture is not secure, then you have a better chance of probably tipping over with that recliner, or tripping over the ottoman, or something that will cause a risk to our folks with Parkinson's. So the next thing we're going to talk about is managing stress, and I'm going to turn that back over to Natasha.
Everybody needs help with managing stress, yes. But especially with a new diagnosis, obviously that's very stressful and has an huge impact on your daily life, just with the new medication schedule and just managing that diagnosis. One of the things that we recommend is just trying to keep your daily normal activities as close as you can. Those good friends and family members that are support to you, just making sure that you have that quality time with them just helps with some of that of the mental health aspect of the diagnosis as well. And regular exercise, so which all the big therapy, swimming, physical therapy, all of that good stuff, all helps keeps you able to do those activities that you love, which also goes back to supporting that mental health. And then also getting plenty of rest, as we heard from some of our other providers today. There is a lot of insomnia with this diagnosis, and so just trying to go to bed at the same time every day, have those good sleep habits, turn off the electronics, all of those good stuff. And then also, if the insomnia is quite severe, just talking to your provider about possibly getting a referral to a sleep specialist. We've got several that their kind of expertise in sleep in Parkinson's patients.
So I'm not sure how we're doing on time, but we wanted to reference a few folks here where we got some of our information. We also want to thank the providers that we work with, Dr. Shaw, Dr. Malik, soon to be Dr. Richmond, and the other providers that are a support, like with sleep and whatnot. We are here as nurses to support you and what you're going through. We are here for the patients and the caregiver. If we don't know the answer, we're gonna do our best to find that answer. That's part of our job. Is we're part nurse and part investigator. So we will do what we can to support you and help you have a higher quality of life. So with that, I thank all of you for coming.